All right, future vets, welcome. If you're gearing up for your parasitology exam, then you are in exactly the right place. Think of this as your high-yield study guide for endoparasites, designed to give you the absolute must-know info for your exams and, for your first day out in the real world. So, here's our game plan. We're going to start with the basics, get the foundational concepts down, then we'll meet the usual suspects, the parasites you'll be seeing over and over again. After that, we'll get practical and talk about diagnosis and prevention, and then we'll wrap up with the really big picture, public health. So, let's jump right in. Okay, let's do this. Before we get into the nitty-gritty of who's who in the worm world, we've got to make sure we're all speaking the same language. Let's lock in these foundational concepts first.
So, at its core, this is what we're talking about. Parasitism is not a friendly relationship, right? It's basically biological theft. The parasite always gets something out of the deal, and the host is always the one that pays the price. Losing nutrients, getting tissue damage, you name it.
This right here is your first big sorting hat moment. You've got your ectoparasites, those are the guys on the outside, like fleas and ticks. But our focus today, what we're really diving deep on, are the endoparasites, the invaders living inside the animal's body.
And hey, it's not all about worms. Don't forget about these little guys, the single-celled protozoa. And their secret weapon? It's this tough little shell called a cyst, which basically lets them just chill and wait out bad conditions until they can find a new host. The two names you absolutely have to know for your exam are Giardia and Toxoplasma.
Okay, let's talk strategy. The parasite's game plan. You see, understanding a parasite's life cycle is everything. Seriously. Because that's how we find its weak spots. That's how we figure out how to break the chain of infection for good.
This next part, super important. You have direct cycles, which are pretty straightforward. Parasite passes from one host into the environment and then into another host. Easy. But then you have the indirect cycles, which are way more complex. They need a middleman, an intermediate host, to get the job done. This difference is absolutely key to how we prevent them.
So check this out. A perfect example of a direct cycle is the whipworm. It's so simple, right? It's a closed loop. A dog ingests an egg, the egg develops into a worm, that worm lays more eggs, and those eggs get passed out to start the whole thing over again. No middleman needed.
Now compare that to the tapeworm. The key player here, the absolute VIP of this whole operation, is the flea. Without that flea larva munching on a tapeworm egg and acting as a little living taxi, that tapeworm parasite is going nowhere. It just can't complete its journey.
All right, now for the main event. This is the Rogues Gallery, the most wanted list, that you're going to be dealing with pretty much every single day in practice. Pay close attention to these guys.
Look, this table is basically your exam cheat sheet. Seriously, hit pause if you need to. Your goal is to be able to connect the worm's name to three things: who it infects, how it gets there, and the main symptoms it causes. Ready? Because we're about to put that knowledge to the test right now. Okay, time to put on your detective hat. Linking what you see, the clinical signs, to a specific parasite and then knowing exactly how to prove you're right, well, that's a core skill for any vet. All right, first case. Imagine this. An owner brings in a tiny kitten. It's got this noticeably round, swollen tummy, a classic potbelly, and they mention it's been vomiting. Based on that chart we just saw, what's your number one suspect?
Yep, you got it. Toxocara catty, the roundworm. That potbelly kitten look is a textbook sign. It should be screaming roundworm to you. And don't forget, they can get it straight from their mom's milk, which is why we see it so often in young animals.
Okay, next case. You get a call from a dog owner. They're worried because their dog is, well, scooting its butt on the carpet and it's had some diarrhea. So what parasite pops into your head? And, just as important, what's the intermediate host we need to worry about?
This is a golden rule, so remember this. If you diagnose tapeworm, your treatment plan has to include flea control. If you only treat the worm but ignore the flea, you're just putting a Band-Aid on the problem. No fleas, no new tapeworms. Simple as that.
And for a lot of these guys, this is how you're going to get your definitive proof. It's called a fecal flotation. It's actually a pretty clever technique. You mix the sample with a super dense solution, which makes the lighter parasite eggs float right up to the top, where you can easily scoop them off and ID them under the microscope. You know, diagnosis is reactive. It's fixing a problem that's already there. So now, let's get proactive. Because being a great vet isn't just about fixing problems. It's about preventing them from ever happening in the first place.
Think of effective prevention as a three-pronged attack. You can't just throw pills at the problem. If the environment is contaminated or if those intermediate hosts are running wild, you're always going to be fighting the losing battle. It's all about sanitation, smart deworming, and controlling those vectors.
I love this analogy. Let it sink in. A flea isn't just a nuisance. It's an infected taxi for tapeworm. A mosquito is literally a flying syringe delivering heartworm. This is why controlling these vectors isn't just an afterthought. It is a core part of internal medicine.
Okay, for our last section, let's zoom all the way out to the big picture. And this part is really important because your responsibility as a veterinarian goes way beyond just your animal patient. Zoonosis. If there's one word you take away from this whole talk, I want it to be that one. It's when diseases jump from animals to people. Parasites like Toxocara, the roundworm, pose a very real risk, especially to kids. This means every single conversation you have with a client about deworming is also a public health intervention. This is what we call the One Health concept in action. Animal health, human health, environmental health, it's all connected. So when you deworm a puppy, you're not just treating that animal, you are protecting the family that loves it. You are a guardian of public health. That's how big your job really is.
So, as you're studying for your exams, I want you to think about this question. It's not just about memorizing life cycles and drug names. It's about how you're going to take all this complex knowledge and translate it into a simple, clear conversation that convinces a pet owner to take action. Because that's how you'll protect both their pet and their family. And that is the art of being a great veterinarian.